Hey everyone, welcome to the AAFE Training Center. It's Crystal and I'm here today with one of my patients. She is going to be getting some lips done. So come on in, I'm just going to show you a little bit of her lip anatomy to start. So she actually had her lips done, that was the first time when we did them last, right? Is that the first time you had them done? Okay. When was that? In February. So it's been about 3 months since she's had her lips done and she's just wanting a little bit more. So we're gonna use some techniques to kind of pick up that top lip a little bit and then just give her a little bit more volume. So let's get started. All right, so she has already been topically numbed. We use like a BLT. I typically let it sit for like 10 minutes. And now we're getting started. So these ones are always a little pinchy. I always warn the patient. Coming in from the top like this through the vermilion border is just a little spicy, is what we like to say. So it can make eyes water and the sensation like you have to sneeze and stuff like that. But this technique is used to kind of help pick up this top lip, just to give her more show as opposed to projection. It's one of our most advanced techniques taught for lips, because it does take a certain amount of product and depth and knowing where you're injecting for sure. Doing okay?
Mm-hmm.
Okay.
It is spicy.
Especially at the top here at the vermilion border, it's a lot. So we're actually using a different product than last time, which typically I don't love like mixing products, but it has been actually over 3 months, almost 4 months since she got the last product. So I'm okay with switching it. So I think the first time we did a Revenus Versa, which that product's really nice. It's like probably our most natural appearing that we use in the lips. And now we're doing a Juvederm Ultra, which will give her just a little bit more structure. Her sister actually has her lips done too, and she got Ultra in hers. And she liked the way that there was just a little bit more volume. So now she's getting Ultra. All right, let me just wipe a little bit. So bleeding obviously is normal. I always like to massage a little bit too as I'm going, just to make sure it's kind of settling in the way I want it to. But I'm gonna sit her up, I think, a little bit and then just kind of look and see what we're looking like. Okay, so I sat her up a little bit. I'm happy with the top lip, the shape of it. So I'm gonna start doing some of that same technique on the bottom, which will help to just kind of like pull this lip down a little bit more and give her more of like a pouty appearance. And then we'll kind of go in and just give her some standard volume, but these are spicy as well, unfortunately. She's not even flinching though. She's a great patient. This product will swell a little bit more as opposed to the Versa that she got the first time. Any of the Juvederm products are hydrophilic, meaning they pool water, so she will see a little bit more swelling with this product, but only for like the first couple days. And then that typically will go down and you'll be able to actually see what your lips are looking like. But I always warn patients when using Juvederm, because especially if it was their first time, they might kind of look in the mirror and have a mini panic attack when they see how swollen their lips can get. But you almost want them. I always tell my patients, like, I want you to look in the mirror and be a little alarmed, because once that swelling goes down, you're gonna love them. If they look in the mirror right away and they're like, oh my God, I love them, then you know they're probably gonna end up wanting more, because they're definitely swollen. Looks nice. All right, I'm just gonna go in now with the normal, the needle and syringe that the Ultra comes in, and just start giving her a little bit of just standard volume. Always pushing small amounts. Nothing crazy. You can always add more. Open a smidge. She has really nice pillows on her bottom lip too. You can see she has like a really nice natural pillow here and a nice natural pillow here. So I'm just trying to kind of accentuate those a little bit as well. Still doing okay? Okay. I think a few more pokes and then I'm going to kind of massage a little bit and see where we're at. I always like to give like just a little bit in the corner. Our lip naturally kind of falls off there and gets smaller, so you want to keep it that way so it's as naturally appearing as it can be. But if you don't feel it at all, then you can kind of have like a drop off of that top lip. So I like to just give a little bit laterally there. Okay. I'm going to massage out her lips a little bit and see what we're feeling and looking like, and then clean her off really well and have her sit up and smile and do all that kind of stuff and see where I need to be nitpicky and open and correct any other areas that I see that I want to make sure she's as symmetrical as possible. I always do like to have my patients, like I try to watch them when they're talking, also like smiling or laughing to see, you know, what their lips look like in their most natural state, you know, when they're talking or laughing or smiling, not just at rest. You want to fill, you know, to make them look perfect all of the time, no matter what they're doing. And it can be tricky. That's why we say this is almost like an art. Okay, let me wipe off so I can see what we're working with here. I didn't feel any major lumps or bumps. That's kind of what I was doing. Just seeing if I feel any like big deposits of product or anything, which I didn't. But that also kind of helps to just like mold the product in the way you want it to be. Do you want them close? So molding the product in the way you want it to be is really nice because, you know, we always say like anyone can inject filler, but it makes a really good injector, you know, the way you massage the lip and kind of put the filler where you want it to be. So I'm gonna have you sit forward all the way. Open a little bit. Good, smile. Nice, relax. Open a smidge again. So show you guys, so like what I'm seeing when I'm looking at her, I told her to open a little bit so you can see this side is just like a little bit more fuller all the way, whereas this side you can really see that pillow. And then I also see that this side's just a smidge fuller here than here. So I'm gonna go in, probably do a couple more pokes and then see where we're at after that. But I'm liking the shape. The peaks are looking symmetrical. It's just those two little areas that are catching my eye. So go ahead and relax back. Turn that way a smidge and then open a little bit. Open. Close. Looks better. Okay, that makes me happier. So I'm just gonna do one last final massage a little bit. Make sure I'm not feeling lumps or bumps. Everything feels nice and smooth. I always tell my patients too though, you know, even though we're doing this at their appointment, when they leave, they could still have like a few lumps or bumps just in that like beginning phase until that filler really settles in. So that's completely normal. Afterwards, we always say, you know, don't use a straw for, you know, 24 to 48 hours. Typically, that's when the product is the most moldable. So just keeping that in mind. Ice lightly, Tylenol for soreness, but they really shouldn't have pain. That's actually a sign of a complication. So they, you know, might have a little tenderness, but no real pain. Close, smile, relax. Good. Okay, I'm gonna put some stuff on ya. Okay, so we are finished. It didn't take much time at all. Come on in and take a look. So she's all cleaned off, wiped up, and we use a really nice balm and oil that have like hyaluronic acid. There's arnica in there, so it really helps to kind of heal the lips quicker, and it's very hydrating because at first their lips are super dry. So here's the final result, and you'll see a before and after here at the end of the video.